Good afternoon, everyone. It's 4:05 right now. I call to order the Health and Mental Health Committee meeting of the Orange County Legislature. Please note this meeting is being transmitted live via video stream. The public can find the link to this video stream by visiting the Orange County website, clicking on the tab for the legislature and locating the meeting on the calendar. Please silence your cell phones, tablets, and other electronic devices. Be mindful that the microphones here in the statutory committee room are very sensitive and robust. And at this time, if you could please join me for the pledge of allegiance. I pledge allegiance
to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Great, can you do roll call?
Spino, Anagnostakis, Sellers,
Here.
Graziano, Lupon,
Present.
Sutherland. Here. Littell. Here. Tui.
Here.
Present 3 absent.
Okay, thank you. First up, we have Darcy Miller, Commissioner of Social Services and Mental Health. And Todd,
Good afternoon. Tammy Ryan, our
Tammy.
Director of Chemical Dependency Services for the Department of Mental Health, and also the project lead for our Healing Communities Research Study, is joining me today.
Kane, you're gonna go through your report first, your update.
Yes, we go through update first. So we handed out some papers to you. Which is, I'll try to keep it as brief as I can, but I appreciate the opportunity to look at the opioid activities throughout 2022. Acknowledging that you no longer have a special committee, but it is part of the oversight of this committee. So we'll take a few minutes just to give you the updated information.
So do you want to do this first, or are you gonna go into the opioid, which is up next on the agenda? Item B?
Oh, I apologize.
No.
I put that at the top of my, of my report, my updated report.
Okay,
So in my
so let's do
mind,
this first.
they were together.
Yeah, okay.
They're one and the same. Okay, so overdose data, just to make a note, we only have medical examiner's office data through 2021. The medical examiner's office has some support from the larger health department and epidemiologists who are going in there to work with them to try to standardize some of the data collection for them as they have had a great deal of work to do in the medical examiner's office. It will help us once we have that data because it's difficult to do the comparison and to assess whether we've had increase or reduction in our fatalities. And much of our work is really focused on not just a recovery path, but in reducing fatalities specifically. So as you see,
And did this come about from the oversight committee, I mean, from the opioid settlement committee?
all of it is part
All
of,
kind of package?
is all packaged together. That all of our work around opioids. So we have the opioid steering committee. We have work groups under the opioid steering committee. We have the settlement opioid advisory committee, and we have the healing communities study advisory committee. All three of those very large collaborative efforts work together with each other to determine what our priorities will be and the statistics that we keep around opioid fatalities, as well as data that comes in from the state as far as those who are going into treatment, how many of them are on medication assisted treatment. That helps to design and determine how we prioritize our goals.
Okay.
So,
Legislator Sullivan, you're on the committee?
Yes, the
Yeah,
settlement committee.
that's right, fine, okay.
thank you.
All right, sorry, Darcy.
No, that's okay, that's okay. So here you see both fatal and non-fatal overdoses on page 2. Sorry, the print is a little small, but you're going to see much smaller font as you go forward. So even with my glasses on, I'm struggling to see. I thought I'd save paper, but maybe I shouldn't have. Would have made it much easier for you to see. So we do have a decrease according to ODMAP, which is a system that collects information from first responders. We are showing a decrease in our non-fatal overdoses being very small, but in our fatal overdoses being at 36%. If that holds true once the medical examiner's office confirms and verifies the data, it's going to be a very positive outcome for us in the county, although it doesn't negate the value and the importance of those who did lose their challenge with addiction. So this is just another way of looking at the data and also breaking it out by age group. We still significantly have the greatest number of fatalities between the ages of 25 and 44, not far behind in 45 to 64. But that helps us target age groups. So, data leads our planning. Moving quickly to page 4, you'll see gender. And it still continues to be male dominant as far as fatalities and loss. And then the next, you'll see race. We have seen by research and by surrounding areas and across the country a rise in overdoses, fatalities in people of color. We have not seen a significant increase in Orange County, but when we look at specialty populations, and Tammy will just quickly go through some of the work of healing communities around specialty populations, we are ensuring that we're paying special attention to those populations that have rises in their fatalities in other areas, across the county or across the state and around the country. Just gives the overdose alert. We've talked about that. We have this overdose alert that comes out from OD MAP. These are the criteria with which it comes out. And then our peer support package that is part of our planning for overdose response. So for those who are revived and survive an overdose, we have a team that goes out and works to make connection with those individuals, hands out this packet of information. It includes naloxone, which is a life-saving substance, and fentanyl strips for those who either use fentanyl as part of their drug of choice, and those who use other drugs and may be inadvertently impacted by fentanyl. This is the opioid emergency kit on the last page that's spread throughout some of our county offices and other locations. The coalitions across the county are helping Tammy and the team put those together. It's part of harm reduction work that became part of our discussion in the Orange County Opioid Settlement Fund priority area. So just to help you understand, I'm sorry, do you have questions about the data before I move to the next?
Sure, thank you. Trustee, page 2, slides 3 and 4, the disclaimers on the bottom. This does not capture all overdose occurring in the county. Is that because you're waiting for the toxicology for the line above that, or can you explain that a little bit?
It's just, where we're able to get the data from. So, someone may have an overdose and be administered naloxone at home, and we wouldn't know about that.
Okay. And then on page, slides 7 and 8, you were right about the numbers and everything getting smaller. I'm also having trouble with the colors.
Yeah.
So the largest part of the pie charts
Mhm.
are on slide 8 are white, correct?
Correct.
Am I reading that correctly? Okay.
Yes.
And then I can't, using pie chart number 1, is the Asian population the 0.0%?
Mm-hmm.
Okay, so I did see that correctly. And then above, that's fine. I don't need the exact numbers. I get my
The
magnifying glass
purple
out.
color is.
Yeah, no, I was looking at the numbers, but I think I can see them pretty clearly now. Thank you. That was, and then the last part of the question is, can you clarify where these kits are being distributed? Where they're being installed?
Yes.
On page,
The boxes
the
left.
box is on slide 11.
Mm-hmm.
We have about 50 currently implemented in the county. There's a couple of different strategies and how we're implementing them. There's community coalitions that Darcy was talking about. You might know them as anti-drug coalitions, Team Newburgh, Warwick Valley. They're all over the county. We have 5 very active ones, Tri-County. We have 2 or 3 others not as active. They're helping to take a lead in their catchment areas. And within those catchment areas, we know that the majority of overdoses are happening in the 3 big cities. So those are going to have more Knox boxes than you will in some of the more rural areas. But there are other, what we call hotspots. You'll see some of that on this chart. Parks, rest areas, businesses that might
So
be
there were-
open 24 hours. They're all over.
Yeah, so because I was always under the impression that in order to administer the Knoxville, you had to go through training. So I was kind of.
True. It does include instructions on the box. So, whether you
Yeah.
have the training or not, if you're able to pull it out, read the instructions, you're supposed to call 911 anyways, and they can have to walk you through
That's
it.
fantastic.
The other thing that I would say about these is that Columbia, who we're working with in the healing communities, they're geo-mapping where all of the boxes are. The last geo-map I saw did include all the sites, so they're still updating it, but it will be available to the community to be able to see.
And
it.
that is linked just as of this week. We just linked it back to our homepage for Department of Mental Health. Couple things just to add on to what Darcy's saying. On the side of these boxes, it's actually a QR code. So it's a very YouTube, user-friendly type version of a video. When we first started doing naloxone, it was with a needle. It's very different.
Yeah.
With intranasal, it's much easier for the layperson to use, similar to performing CPR, even using an AED defibrillator.
That's fantastic. Yeah, that's great. Thank you. Thank you.
Do you know of any locations? We have how many? 175 total, so 50 are out.
Pick a location, I could tell you. I mean, I know that all 3 cities have some. I know Warwick is working on some. I know Town of Walk Hill has, I think, 10. So depending on the area that you're looking at,
I can think of 3 high areas that I'll identify to Darcy in an email.
Yeah,
That would be a great
absolutely.
place for them.
Yeah.
Thank you.
Well, you mentioned that with the geolocated,
Mhm.
is there, you didn't get to the big sheet yet, but I mean, I would think that don't we have like a hot map on it where the overdoses are coming from?
Yes, we do.
And then I would think that that would dictate where we could put boxes
Correct.
Yes.
so that it's evenly distributed to where,
Good point.
or more distributed rather, to where the biggest cases are.
It's the advantage of ODMAP, although it's separate data streams, and I know Darcy spoke to, ODMAP doesn't capture all of them, that's why the numbers are a little different.
Mhm.
For instance, they don't capture ER visits, but what they do for us is tell us which areas have the preponderance, or if you will, and we can tell if it's fatal, non-fatal,
Yeah.
with naloxone, without naloxone, age, all the demographics, which is very helpful. Planning.
It's part of targeting, and that's what Tammy said, the cities do have the highest
And are you doing
percentage.
any
but scattered.
promotion for it, to promote the fact that they're out and about, or they,
Yeah, well, amongst all of our staff, when you look at the three targeters, I mean, I don't know. We have 200 people who are part of our task force.
Yeah.
who even if they don't attend, they get all the information. These are providers, concerned citizens, family members, schools, a large number. So everywhere we go, we're ambassadors of the message, but they also know. So we share this data every time. We have an image of the OD map so they could see. We send it out typically with our minutes. So they have the information. And that's the best tool we can share.
okay.
Is really, where's it happened? And part of the overdose alert, the purpose of that is to let our provider systems know there's a cluster of overdoses in this particular area. And that then helps them to reach out to clients they might be concerned about, for coalitions to be out advocating about. Obviously, there's something out there with a high concentration of something that's leading to a high number. And they're not, the overdose alert, by the way, I just want to say, they're non-fatal, most of them. There may be 5 or more in a 24-hour period, but they're not all fatalities. And people get really nervous thinking 5 people died, but 5 people did overdose and become very ill and could have died.
Just to your point, and we'll talk about it more with this, but because of the Healing Communities work that we're doing, we're actually just wrapping up the first cold communications campaign that is being processed through the county exec's office, Facebook, some of that social media advertisement. So that is happening
I
simultaneously
have seen a lot on Facebook
about
from the
naloxone.
county. Yeah,
Wait,
it's bilingual.
Yes, we're doing it in both languages.
So
I was
know you're
talking
Good traction with that,
Justin said today, listen, he feels, it's not the way he typically puts things out. She's like, Darcy, I feel like I'm doing it a whole lot. He is doing it a whole lot. It's scripted by Columbia. But I would just say to you and anybody who's listening, you see it on the county government webpage. The benefit of it is sharing it.
Yeah.
Because one person shares it, that's 400 more contacts. If those 400 share it, it's 1,000 more contacts. That's what we hope to see happen, and what Columbia predicts will happen if they keep sharing it over and over again on the county's Facebook page. Hasn't been shared as often as we would like it to be shared.
But you're tracking that, how many times it gets shared, you get that metric.
Yes.
Sometimes it's only 2 times, sometimes it's 26 times. I would love to see it be 2,600 times.
Yeah.
Okay, so we'll move us into this quick graphic here. This is Lacey Trimble, our talented technology person in our office. We have met a total of 5 times as the opioid settlement committee. We have come up with priorities. This is still in draft form. So we have a meeting next week. Tammy and I are beginning to meet with people in all different stages of recovery, their family members. We want to share with them this document. We want to get their input from them before we finalize it and move forward with putting money out into the community. So I'll just run you through really quickly. Priority number 1, improved access to care, meaning you call, you get an appointment that day, you get referred to somebody who gives you an appointment that day. You have a warm handoff, you have somebody who will walk you through your first step of your recovery plan, rather than being solo and not being able to get the assistance you need. So that's the single point of access like response. Manage referrals and transitions of care when people come out of detox and have to go into rehab or begin outpatient treatment, having a support like the peer support to be there to help walk them through that transition. We know where we lose people and we know how we can engage them to keep them connected in their recovery pathway. So this is to expand access, ease process for general population, PCPs, law enforcement, emergency responses, and et cetera. That has been determined as the number one priority for our settlement committee. Next is looking at prevention. School environment, the Healing Community Study focuses on 18 and older. Our settlement advisory committee agreed to focus on 18 and younger, to look at schools, K through 12 prevention models being some of the best practice models. I already have a school that has volunteered. Highland Falls would like to be a pilot to do a K through 12 curriculum. And we're very excited about that. It's integrated into their school day as part of the messaging that they receive throughout their time K through 12. And we're excited to be able to use some of those best practice models. Finally, at the bottom is part of the harm reduction, which complements, again, the work that's being done with Healing Communities, and that's fentanyl strips, the naloxone boxes we just talked about, and expand the overdose response. So you saw the numbers on page 5 of overdose response compared to the number of overdoses. The more support we have, the better that's going to be. And I also will just add to your thinking, the health department, who's a partner with us in many of these projects, including the naloxone boxes, they have chosen, not they've chosen, the community needs. Secondary goal is response to opioid overdoses, as well as access to mental health care. And their model that will come out as a guideline for emergency rooms and primary health providers across the county will put a standard and guideline in place that really will encourage increased response for people who overdose, and this overdose response a need is going to be greater with the work that they're doing.
Darcy, can you tell us exactly what a fentanyl test strip is and how that works? I've never heard that before.
Yes, I could tell you, but Tammy's probably better to tell you.
Okay.
It's just what you think. Have you ever seen a diabetic test strip?
Yeah.
Test strip. It looks similar to that. You stick it inside the substance, it will tell you if there's fentanyl in it.
Oh,
So we include those in the naloxone kits, and part of the push is to make sure that they're in every naloxone kit. And as Darcy had said before, there's kind of two schools of people that, at least with Columbia, people who may know about fentanyl that are seeking it because they're further in their addiction, and people who may not know about fentanyl and are accidentally using it for whatever reason. So it literally is maybe the size of my finger. The packages we have are a purple color, and there's a couple of strips. We include 10 strips in every kit. So not everybody's doing that yet, but that's the goal. Does that make sense?
so to test it.
Yeah, to see if it's
So,
that.
so an addict may have their
So they're using
drugs,
cocaine.
and then
Yeah.
they would go and test it and then decide then if they want to do it or not?
It's a diversion tactic, correct,
There's fentanyl,
in everything.
it's what they use to cut the pure cocaine
No, I know
and
that. I
to
know
expand
that.
the
I
product,
know
and
what
it's
the
got
strip
what, how
is.
much higher percentage of overdose rate and fatality than straight?
Well,
With the fentanyl
93% of our fatalities involve
Yeah.
fentanyl.
Yeah,
And I just want to say, they don't really use it to cut, if they used it to cut cocaine, everybody would be dying who touched it, but they do add some to
Yeah.
the cocaine. And it is more addictive, and then people go back, they seek the high, it's a
There's
vicious
also
cycle.
a cross-contamination thing that happens.
Yeah.
right,
When they have the
people are
drugs
using
next to each
substances.
other.
Yeah, so we hear from many people, I'm not using fentanyl, and it's like, well, this is what the numbers are telling us. So we know that it's coming in different venues, and it's synthetic, so it's very hard to manage that.
They may not realize it.
Exactly.
It's in the cocaine.
Exactly. Yeah.
The heroin.
Or they say in marijuana, it's just pills are sold on the
Yeah.
street, you think it's oxycodone, and it's not, it's fentanyl.
Yes, yep,
Or even when the drugs are being
Yeah.
packaged, they might have fentanyl
Exactly.
with one drug that they were packaging and it's still on the table, so they're
Yeah.
mixing it and then accidentally fentanyl is getting into another drug.
paraphernalia, scales.
Yes. Because it's very small
Yeah, like
amount of
this.
fentanyl
Say a
that
fingernail.
Can't get it.
can take your life, yes. Housing, geez.
Today's a housing day.
It's on our list too.
My favorite.
So, yeah,
Yes.
right, it does come out right, when you look at it this way, and it's really good work from folks, good conversation, and thank you for being there, Legislator Sutherland, and being part of it. We had a meeting with the OMH and Oasis commissioners just last week, They're really working hard on trying to expand some of the housing continuum, in particularly for people who are in different stages of recovery. In the meantime, I think we talked to you about the Oxford model here. They had an anonymous donation. They've opened 2 houses. They're currently 16 slots for people who are very happily living in permanent housing in their different phases of recovery. And then they're looking at opening a woman's house, which we're very excited by. In fact, I talk about it wherever I go because it's just such an exciting model of permanent housing where people have peer support in their recovery. Rockland is looking to go into contract, Dutchess is going into contract, upstate counties are. It's just taken hold as a best practice peer model for permanent housing. And it's an exciting opportunity. We're going to be able to do more of that here. Recovery housing for parents with children. Tammy has been a proponent and advocate of that for quite some time. And affordable housing options, all priorities. Workforce, I won't go into detail on this. You all know the challenges with workforce. We had a good discussion. I'll tell you that providers are very passionate about workforce being a priority. The challenge for us would be there's workforce conversation happening on the state level. Really requires some decision making that would be outside of using settlement funds. And if we use settlement funds for the first 3 priorities, leaves very little for a workforce when you have other entities that will be addressing it. And I know that without workforce, you can't do the other 3. So it's still an undecided state. We want to hear what our families and people in recovery have to say about that as well. Just want to give one caveat. We talked about transportation.
Yeah.
Yes,
We did talk about that.
there are some other options on the SOAR. So there's CVHS who administers the state opioid response funding that comes into CVHS and spread throughout our region. They were given specific money for transportation. They're close to unveiling their plan. And also we had Mental Health Association reach out to Assemblywoman Gunther for some specific funds when they get a call through there to be able to pay for transportation. So that is off the table for opioid settlement funds today, but could go back on over time if we discover this greater need.
Thank you, Mr. Chairman. On the topic of transportation, so I believe it was Rockland, Ulster, and Dutchess, or maybe 2 of the 3 who are doing free transportation countywide. That's obviously been a conversation that we had here as well, but just specifically talking about this. One of the biggest challenges that I've faced, and so when I didn't see it, I was like glad that you jumped on that afterward. One of the biggest challenges I've had with my clients is their inability to they might be able to use medical transportation if they call 3 days in advance. A lot of the individuals who are trying to do their appointments, they don't think about 3 days in advance. So, being able to get transportation easily, and especially when they don't really have any money, is so critical. So like that, I think it's so important for us to have some sort of, beyond just like the vouchers, but like even a waiver of some sort, so that individuals who are seeking to be able to get into jobs or get into treatment or get into whatever, they have a significantly easier way of getting around, because the reality is a treatment alone, especially if the person's on the other side of the county and they want to go get Suboxone, or they want to try to find a job, it's challenging. It's already challenging to deal with your addiction and then have to figure out, A, where am I going to live? B, how am I going to get to someplace? And C, all the other things that we're talking about, right? So I'm just really glad to see that we're talking about harm reduction, because years ago that was seen as the biggest taboo thing in the world. So let's continue with that. That's phenomenal. And the housing piece, I think, is so important. I heard the district attorney just the other day, I think it was Mid Hudson News, talking about affordable housing. I think that was
Just
and so, this is something we've talked about. I mean, it's great to see this is obviously completely bipartisan, that we all recognize that housing is super critical. And I agree with the district attorney. I've said it, you and I've said it for the last several years. This is this is the biggest issue I've faced with my clients. Not being able to find them housing, them struggling, getting out of jail, not knowing where the hell they're gonna go, feeling turned away, feeling then desperate, and then immediately going to use drugs. That is us failing individuals. It's us failing them. So I'm really glad that this is. Thank you, Commissioner.
Amy, you want to?
Just let me just give a quick caveat, just to say
Yeah.
this, Tammy goes into a lot of detail. You can't, I
She doesn't
can't
want
read
me to
it.
go line.
I don't know
by
how you can read it.
line.
Don't.
There are three general areas, and some of that, we've been working on them for a long time. What Columbia is helping us do is really, objectify them and how we meet the targets and have realistic metrics. So just give the three generals to you because we've taken up so much time, but I think
Just
for
a
your
real quick
patience.
about transportation to add to that.
Thank you.
The money that Darcy is talking about that's coming down from the state through SOAR 2 is multifaceted. So there will be vouchers, there will be potentially an increased rate, there will be some petty cash. They're looking at different avenues because we know there are different needs. So that's a really good thing.
Another big thing, and I apologize, Commissioner, but one of the big things I've also seen is, for example, some individuals who would like to, who now are eligible to get their driver's license,
Yeah,
they don't have the money to do that.
yeah.
Someone might struggle to get certain things. In other counties, I've seen, for example, with individuals who have children, they've done programs where they actually give people vehicles, help them pay. And that helps a family get off their feet. That helps a mother be able to get a vehicle, it gets fixed up, they pay for the insurance, but that's a person that's gonna be able to take their child to daycare, not have to worry about, taxis or buses. It's a significant thing, and other counties are doing it.
Yeah.
We do that too. I'm just gonna say it
Oh, good.
happens
I
between
did not
No,
know
no,
that.
employment
Mhm.
training and social services combination, so we help, say someone, they need new tires or they need new brakes in order to get to work. That is part of the collaboration between our one-stop, employment training and social services. We can pay for those.
Okay,
Yeah, we do all that support.
do we do that vehicle program, but I know it's Wheels to Work or something like
Yeah,
that?
exactly, yes, yes.
Something like that.
Yes,
It's
yes,
a New
you're
York
right,
State
that's what it's
program.
called, yes.
I was
Yes.
right, okay.
Yes,
So,
you're right.
I'm not gonna copyright it then.
Yes, we do that, yes. It's not so obvious sometimes, but we do offer that support. And right now, those numbers are low, because we don't have so many people on caseloads of cash assistance. Sorry.
Thank you.
No, it's okay. And I had to chuckle because she knows I can go in the weeds, so just to stay on topic. Columbia is doing this national research study, as you know, they're part of, we are part of this study, 16 counties in New York State. The main focus of the study is to reduce opioid overdoses by 40%. And there are 3 evidence-based practices that they're focusing on in that study. One is expansion of naloxone, one is access or expansion of medication for opioid use disorder, and one is around safer prescribing. So if you think of the catchment areas, that's really where we're focusing this work and how it complements all the other work that we're doing. So it's a research study. It's not the same kind of task force work. So they are looking at metrics and who we're reaching and how many we're reaching. And it's probably good you can't read some of these numbers because they're a little overwhelming to read. But as you look in each area, and I'll just talk about naloxone because we had some discussion about that. Expansion of naloxone cabinets is one strategy. Looking at hotspots for those boxes, expanded training is another strategy. Some of the other strategies you're going to see in this area are expansion, working with emergency rooms, that everybody that comes into an emergency room that is identified as having really any kind of substance abuse issue will leave the emergency room with a naloxone kit. Okay, so those are just a couple of highlights right from the top section. From the middle section, the top section is a little more tedious. It looks like a bigger lift, but truthfully, the MOUD, I think, is a bigger lift, right? Because we're talking about continuing to work with providers and prescribers on the value of medication as a gold standard for opioid use disorder. And what does that mean? We have prescribers that may have been waivered, as they say, and can prescribe one of the 3 medications, buprenorphine, but they're not doing it, but they have the waiver. So those are a couple of different strategies. We have a strategy in here to have 15 new prescribers. We have a strategy in here that says we're going to work with current prescribers to expand by, I think it's 20%, we put in there, their caseload, because they are dictated by regulations how many they can prescribe to within certain timeframes. There are some other strategies in here like retention. How do we look at retention of individuals that are actually in treatment up to 30, 60, or 90 days? So that's some of what you see in the MOUD section.
Emergency rooms and
Emergency rooms, absolutely.
We've had a medication assisted treatment work group How many years?
I think it's 3 years.
I actually co-chair that with members of St. Louis.
Oh, yeah, with that one, that's
Yeah,
longer.
so- Yeah, that's. been a
Yeah,
long
that's
time.
longer.
So this is good. It just gives us more work.
Yeah, in New York Matters, you may hear that language thrown around. That's probably one of the big linkage programs. It's an emergency room program that was started in upstate New York that has been very, very successful in working with emergency room doctors. That is a big strategy for us to work with emergency rooms and hospitals on onboarding with New York Matters. And they provide a whole continuum of services once somebody is linked to that program, transportation, medication appointments, peer support, et cetera, et cetera. Yeah, so, and then the last category would say for prescribing, ironically enough, the CDC just came out with updated recommended prescribing guidelines that hadn't been updated since 2016. So one of our main strategies in safer prescribing is to make sure people are educated on what the current best model is for prescribing pain medication or opioids. That's a big lift. It's certainly going to require us partnering with Department of Health and other partners, but that's really trying to kind of impact primary care in a different way. And although we're not really dealing with a prescription issue these days, there's lots of complications around prescribing. Are you getting enough medication assisted treatment? Are you getting prescribed other medications in tandem that maybe is not a good idea? So that's one, that you'll see at the beginning of that list, but some of the other things you see in this area are things that we do that we're just looking to expand, like drug take-back days that our community coalitions are involved in. How do we expand that?
Police departments.
Police
have drug
departments,
take-back.
all the drug disposal boxes that all the police departments have.
Mhm.
How do we re-promote that so people know where to go with that? That's our 3 areas for all these things, and it is a draft, it's a working, living document.
Yeah, believe me, we could go on. I mean, the amount of, because it's such a tragic
Yeah, that's,
epidemic, we spend a lot, I personally spend a lot of hours addressing this issue in our provider system. We couldn't do it without them. We couldn't do it without all of you, without the families and the people who are willing to share in recovery. So that's it in a nutshell.
Just a final question. When we discuss, for example, communities, you have peers,
Yes.
just because that's one of the things that I know you emphasize so much the peer aspect.
Peers are powerful. They're the ones who are doing the overdose outreach response, the transition care. It's really, really good stuff.
So they're saying to you, hey, this is what we struggled with when we were doing this.
Yes.
you'll see just quickly on this list, people with lived experience, they have to review all this, that's this column.
It's wonderful.
Everything's yes, because we have a separate little group for that.
That's excellent.
So they have input and they have an ability to review any of the strategies that.
That is fantastic.
Yep.
Any questions?
Great day.
Thank you both.
Thank
Very,
you.
very
Thank you.
informative. And thank you for your hard work.
Take care.
Thank you. Thank you. We're just gonna need this.
You know what?
That was good.
We all got this by mail, so if we could just all read that.
Yes.
Well, hopefully it did.
I think she covered 90% of it.
She did.
Yeah, absolutely.
She did.
Is that the report?
Yeah.
All right, thank you. Up next, we have item number 2, Lawrence Ledoux, Commissioner Valley View, Thomas Strecker, Director of Finance, Valley View Center. Thank you. Afternoon. Okay, first up, item 2A, to request for approval and supplemental appropriation of funds for the proposed capital expenditure for roofing replacement. Roofing systems in the Hauser Building and the Simon Building, 1997, are reaching economic life. This is proposed capital project number 106 in the 2022 capital plan. Upon approval, a new capital project will be created in the amount of $3,600,000 bonding. Legislative request number 273. Can I get a motion?
So moved.
No. Okay, Lawrence.
Not much more to add. Again, we're going to be funding to get new roofing for both the Cowser and the Simon Building. We got this estimation back in 2021. Obviously, we needed a starting point for funding purposes, and it's 3.6 million. I suspect we'll probably need more. down the road, but we just, obviously, we needed a starting point, so that's why we asked for this amount.
And just to refresh everybody, which the Cowser building and Simon building, that's. when you
Sure,
first
so
come in.
The Simon Building is the main entrance where you come in where the security guards are, and then the Cowser Building has 8 resident units and can house up to 240 residents. And that's, if you're driving down the driveway, it's the first building on your left, the Cowser Building.
Yep, okay, and now, are those units open now, or?
The Cowser Building, yes, there's, of the 8 units, 5 of them are open.
5 are open,
Correct.
and in the Simon building, there's also,
Simon, there's no resident areas. Simon Building is the administration area, the
Town
town
hall.
center,
yeah,
the rehab area, we have our clinic, we have admissions, the beauty shop, that's pretty much the Simon Building.
okay, I see that this is Fusco Engineering that worked these numbers up for you in 2021. Now, will this go for a bid?
It has to, yeah.
Yeah. that's-
Again, you just, this is all for budgeting purposes, this is, it'll definitely go out to bid. It has to go out to bid.
Yeah.
Yeah. Yeah.
Okay. All right, any questions, comments, anybody? Nope, not seeing any, I'll call the question, all in favor, aye?
Aye.
Opposed? Motion carries. Next up, we have the monthly financial. Donna, do you want to take
Sure.
that?
Sure. Hello, everyone. The results we're reviewing are as of 12/2 for November 2022. There has been no change in the IGT funding since the last publication. Typically, by this time of year, we do have another payment. I followed up with Leading Age, and the holdup right now is the Medicaid state plan amendment with the upper limit calculation needs to be approved by the feds before they can release the IGT funding. There's no change to the emergency disaster funding that we received, the 3.2 million. And public nursing home revenues are coming in at 28,678,000. Personal services, we have expensed 17,643,000. Equipment, we've expensed 54,390. On the contractual side, we have just over 2 million earmarked for expenditure that will be expensed by year end and into January. Year to date actual expense totaling 9.5 million. Employee benefits are coming in at just under 14 million. We have a small amount of serial bond debt, 86,830.
Any questions, boys?
Thank you, Mr. Donna, on the IGT, I'm also noticing 2021, there was a remaining balance of 1,703,358.83. Did you already close out 2021? Are we not going to get that 1,700,000, 1.7 million?
You're looking at 2021.
Correct.
Yeah, no, what happened is we got the 5.7 and then at year ends, they accrue for the amount that we're supposed to be expecting. So look for this number in the next posting, depending on the timing of the payments.
Okay, so 2021 is still
She's
open
talking
then?
about 2021.
2021 is, yeah, this,
2021 is done. We did not get, even though we budgeted for 7,500,000, we only received 5 million, almost 800,000. And that other 1,700,000 is not going to be received, correct?
no, that is not true.
Okay. Yeah,
That
so
is
I'm
not
trying to
true,
figure
yeah.
that out.
As of November in 2021, this is as of a point in time. So
Mhm.
as of November 2021, we had received a total payment of 5,796,000. There was another payment that we also received that gets split between 2021 and
2022.
2022. Yep. So that becomes part of, if it doesn't come in December, it becomes part of the audit. And we accrue for that income. I can give you the exact
Yeah,
number.
so,
the next
so this
meeting.
isn't, this is, what I'm seeing on the bottom page isn't the closeout of 2021.
No.
This is comparing month to month.
You got it.
Apples to
November.
apples, so you're
Got it.
comparing this month
Gotcha.
of this year to this month of last
Thank you.
year.
I just want to make sure. 'Cause
Yeah,
I
that's fine.
thought I remember you saying in the past that we did receive everything we budgeted for,
Yeah.
but then I'm seeing this.
Yep.
I got
Right,
confused.
this isn't the final, and the next one that you will see that we publish will be the final.
Okay, great. Thank you. Thank you,
You're
Mr. Chairman.
If you turn to the next page, you'll see November census is 65.04. We're averaging for the 11 months, our performance is 67.81. Lawrence, do you want to talk a little bit about, November?
Yeah, in November, we did have a minor COVID outbreak of both staff and residents, so it did limit us, it impeded us from taking new admissions for well, at least a 2-week period, I believe. So that's why, one of the reasons why the census was the lowest it's been all year.
Okay, then, just, I get, the daily updates that you send, really appreciate it.
Sure.
It keeps us, very, very up to, date on that. And I think the one I read lately was that, you're accepting short-term and long-term, residents.
Yes, we are open to admissions right now, yes.
And then, when we spoke a week or two ago, regarding the waiting list, how does that, impact if we're accepting them? And then, they're coming off the waiting list, or is the waiting list for all the different disciplines that you have over?
The waiting list is just for long-term
For
placement.
long-term.
Right, and it's, it's based on when you submitted your long-term placement application at Valley View, and then you get put onto the list.
Okay,
And then it's essentially, we go down the list, we go to the number 1 on the list when a bed opens up, and then number 2 becomes number 1, and so on and so forth, so.
but when you say that, when a bed opens up though, so you're open for it, but then we're still waiting on beds because some of the units are closed, right?
Well, that's the thing. I mean, we have a limited number of long-term beds, and those units are usually full compared to the short-term rehab unit. And as you know, the only time a bed becomes available is when a resident, passes away.
Yeah.
Usually, sometimes they go to another facility or something, but
And then also, I have one more last follow-up on that with the list. How, I know you can't tell us, but I mean, just trending, how soon does that turn over? I mean, because I would imagine that if someone's on a waiting list, that they could end up getting placed somewhere else. And
They
then
could, and they have-
them. Then you're like, they're saying, oh, no, we're already,
and what could happen is somebody's on the waiting list could be at another nursing home waiting to come to Valley View, and we would still have their contact information. Most of the people on the waiting list are at home and are seeking placement, but they could technically be at another nursing home and wanted to get into Valley View as well.
I guess what I'm saying is how often does it come down to when you move it down that list that people are saying, oh, no,
Again,
we're already placed somewhere else, so the family says that,
I mean, that happens. You could you could be number 1 on the list and we call you and, we're not ready to move right now,
Yeah.
or we're happy where we are, and then we move on to the next person on the list.
so does that happen?
It happens, yeah. I mean, that, giving a timeline is really the hardest thing to do
Yeah.
on the waiting list because, it's all dependent upon,
So I guess
You know.
the majority of people will wait on the waiting list and then accept it, come in.
yes,
Okay.
yes,
That's okay.
yes.
Okay,
If you're on the list, you won't be skipped. It may take some time to get to you.
yeah,
But you're not gonna be skipped. You will be, when your time comes up, you will be contacted.
yeah, okay. And then, just have another question regarding the staffing. How is that going?
It's still a struggle. I know Donna and I were talking beforehand. She listened to a webinar today. The long-term care industry is struggling to maintain staff and to hire new staff. And I wish I had new news that was improved.
Yeah, any of the initiatives that we put in financially?
Not really.
Not really getting
No.
any traction?
Not really, no. I know there's some other things in the works. Hopefully, those will be presented to you guys, within the next month or so.
Okay.
So,
All right, we'll wait for them.
Yeah.
I'm sorry, I jumped in there.
Oh, that's okay. That's okay.
Do you want to go on to the next page?
The last page is just a historical analysis of the bill types, the various insurance companies that we're billing, and the number of days that we bill in each month. We are currently, in November, we were billing pretty much 80% of the population under Medicaid, 1.26% under a Medicaid HMO, and 11.89% of our billable days were attributable to Medicare.
All right, any questions, any members? Nope. Okay. All right, thank you, Donna. And Lawrence, would you give us this?
Sure, I sent out the update on Monday. I hope everybody got it.
Yes.
I did have a typo in there, so my apologies. We do have 3 units closed now. Last month, we had 2 units closed when I typed this up because we were using one of the empty units for a COVID unit, but now we have no COVID cases, so that unit is closed now. So that's why we have 3 units closed. We are, like we mentioned, we are taking short-term and long-term admissions. The CHA census is 23, which is good. We have 2 COVID positive employees, no COVID positive residents. We did complete the second round of reporting for the New York State Healthcare Worker Bonus Program. And we're just awaiting payment for Medicaid. And as soon as that gets submitted to us, then we have 30 days to pay the employees the bonus that they're entitled to. We did have a consultant on site last week. We had a mock survey conducted for our CHA. She was very impressed with our staff and the care that we provided. She did actually 3 home visits of the 3 patients that are currently receiving services. She was very impressed. She did make minor recommendations regarding just how we do some documentation items to ensure that we're compliant with federal recommendations. We did mandatory as a healthcare facility. We're mandated to test for Legionella disease in our water system. We completed that testing. Unfortunately, we were above the acceptable threshold for positivity rates. Any of the areas we tested: fountains, showers, faucets, and any of the areas that tested positive, we installed a point of use filter. And also to address this issue, we're going to be hyperchlorinating the water system as soon as possible, and then we're going to retest again in 28 days. The water is still safe to consume. The New York State Department of Health has been notified and has approved of our plan to address this going forward.
Actually, I do.
Yes.
Could we go back to the New York State Healthcare Worker Bonus? You said the second vesting period is now complete as far as reporting. Now, I know that there were payments issued to employees.
That was the first vesting period.
Right. So when you say the second, is this a different round of people or is this a second payment?
It's a different time
Existing?
period. So the first vesting
I see,
period,
okay.
yeah, the first vesting period was it September to December of 20? Was it a 6-month?
The second one ended on September.
Yeah, so we're up to date. I think the first one was a 6-month period. It
Yeah,
started in
6 months.
2021 and went into
Correct,
22, and
yes.
then the second period went up to September 30th of 2022.
And those checks went out should have been received like the end of October through November.
That's correct.
Yeah. So the
Yeah.
first vesting period, the checks already went out to
To all
staff.
eligible people. at
Yes,
that.
Yes.
only eligible, yes.
So then the second round, all eligible will be receiving it once you.
Right, so the process is we have to submit all the data to New York
Right.
State. That's been submitted and accepted,
Yes.
and it's been accepted by Medicaid. Now we just have to wait for the payment
And then we
comes in one of our
send
Medicaid
it.
payments, and then we have 30 days from the date that we receive it to pay it out to the employees. And we get it out, it's usually about a week or 2 after we get the money.
Yeah.
Okay, great.
So, yeah, we keep the staff updated as to where it is, and they're always anxious to get it, as they should be.
Sure they are.
So we let them know. It's great news. It's great news for them, so it is good news, so.
Thank you.
Yeah, of course.
Anything else or any other questions? Oh, well, Donna, thank you very much. Lawrence,
Thank
Thank you. Appreciate it.
Thank you,
And,
guys.
Thank you.
happy holidays.
You
Thank
too.
you all.
That's right, yeah. Stay safe.
See you next year.
Yes. All right, item number 3, Dr. Alicia Pointer, Commissioner of Health, and Lisa LaHiff, Deputy Commissioner of Health. Lisa,
It's just me,
you're solo today. Oh, no, you're not.
HR representative.
HR.
Derek.
Okay, good, thank you.
Very good.
All right, we have item A, request to create one Director of Environmental Health Services position, grade 25, and abolish one Deputy Commissioner of Health for Environmental Health position, grade 26. It's legislative request number 299. Can I get a motion, please?
Okay, so just yesterday at the Personnel and Compensation meeting, it was requested and the act was amended to reflect that it was just going to be the creation of the Director of Environmental Health Services and the request to abolish the Deputy Commissioner for Environmental Health be tabled with the hope that that position just remain dormant on the books. The health department is not seeking to fill it. And our reasoning behind that is when we created this position in September, the Deputy Commissioner for Environmental Health Services, it was created with the nature being competitive until New York State Civil Service had an opportunity to exclude it from the competitive process. So the timing of such was that at the time that I wrote this recommendation, it had been pending and we were just going to remove it. And we did have our our public hearing with the Department of Civil Service, and they did approve it in the exempt class. So the fact that that classification has been removed from the competitive class, our feeling and our recommendation from Human Resources is just to leave that position on the books. It was a very difficult recruitment, and in the event that this classification, Director of Environmental Health Services, if we have recruitment obstacles, we can then maybe request to come back and fill it rather than abolish it and be unsuccessful with the director and need to go back to the deputy. We take these, recommendations, pretty highly with the Department of Civil Service. And it's just an avenue for us to keep it on the books. The Department of Health is not seeking to fill 2 positions. They only have dollars for one. And we're confident that, we're hopeful at least, that the director can be filled, meet their purposes, and move on with their organizational needs. In the event that we're not successful with that, we do have, return to Plan A as an option.
Okay, so right now you're just gonna create one, get rid of it.
Well, we're not getting rid of one, we're just creating one and leaving one unfunded, open, yeah. So,
We would need a motion to amend.
correct.
I'll second.
Okay, so can you make that
It's a motion just to create the Director of Environmental Health Services, and we're not abolishing the Deputy Commissioner position.
okay, so how are you gonna word
Are you defunding it?
We are leaving exactly as it is. So
Why don't
we're,
we
it? Yeah, Betsy, if you could,
Sure.
use the same wording as yesterday?
Sure. So yesterday at PNC, the motion was made to just solely create the one grade 25 position and to remove the language noting the abolishment of the grade 26
okay.
position.
that's exactly the motion.
Kevin Darian made the motion, Janet second, and call the question. All in favor? Aye. Any opposed? Okay, motion carries.
Thank you.
Right. And Lisa, you have an update? Oh, hold on, that was just for the motion.
Yeah, we still-
Change.
Oh, yeah, you have
Okay,
to vote
We
on
have to vote the actual.
So now we'll call a question on the actual motion. And all in favor?
Aye.
Opposed? Motion carries. Okay. Please.
Thank you. And thank you for doing that. The recruitment for an engineer has been very challenging, and we would like to have a options open depending on if we find the right candidates. To some people, a deputy commissioner position might be attractive. And to some people, a director position that does have civil service protection would be more attractive. So, you know, we have some flexibility, and again, we're not planning on going over.
That's fine.
And if I remember correctly, there were some thoughts about how finding the two things under one could be challenging in the sense that one is more medical, one might be more engineering, right? So like,
Right, which
which makes sense, that you might not find the whole thing in one package. I mean, ideally we do, right?
Right.
That would be wonderful,
Right.
but
And
if we
that-
don't,
Right, and that's really fundamental to the department's goal of supporting the economic development in Orange County and processing plans and also addressing residents' septic and water issues in a timely fashion and to have someone direct that.
that makes sense.
So we're appreciating that. Dr. Pointer couldn't be here today, but she did want me to share with you that as far as infectious diseases, flu is rampant in Orange County. Currently, Orange County has 1,133 reported cases. And again, those are people who are going to the doctor and having the swab and are confirmed cases. This is an over 100% increase from last week. Statewide flu-related hospitalizations and cases continue to increase. There have been no pediatric deaths due to flu in New York as of now for this season. The Orange County Department of Health has added to its COVID vaccination clinics that it's having in Middletown and Newburgh, offering flu vaccines, and also for our homebound residents who are getting COVID vaccinations, they can also get a flu vaccine.
Okay, the booster too, the,
They can get the booster too. They can get whatever, wherever they are in the cycle, they can get the appropriate booster. And for some people, it would be maybe their second booster.
Yeah, yeah.
So as far as COVID, COVID is still with us. We do have a 7-day average yesterday of 145 cases. Our 10-day average is 116 cases, but which is still a 26.8% increase from the previous week. The total deaths from COVID are 1,244 since the beginning of the pandemic. Our community level, which also includes hospitalizations due to COVID, is medium. We do have right now an immunization rate of about 67% of the residents of Orange County have their primary series, but unfortunately only 12% have their booster. So it would be a good time to get a booster, yes.
legislative, what's up?
Thank you, sir. The increases that we're seeing are post Thanksgiving as was predicted by the CDC. Correct? Thank you.
Yes.
Thank you, Mr. Chairman.
Okay, and then, I know I read it and I couldn't, I don't have a copy of it, but then you also had on your numbers for RS, or,
For RSV, yes, which is another respiratory illness. Most of the time we think of RSV in children, but now we're seeing more of it in adults. Unfortunately, yes. Yes, RSV hospitalizations have dropped significantly though this week. Their peak was about the week of Halloween. The statewide percentage of positive tests is also decreasing. We had 16% positivity 3 weeks ago and 14% now. The 16% was sort of a high. So still something to be aware of.
Lisa, with the RSV, what does that exactly stand for again? Respiratory?
I'm never sure what the S is. It's a respiratory virus.
And is this relatively new, or is it another name for something that we use called upper respiratory infection, or, it seems like it just came on the scene, you hear a lot about it.
Right, and historically, it's been something that maybe your pediatrician would have told you about for for your infant.
He's 18 years.
Respiratory syncytial virus.
Yes, you can never remember that.
It's quite the word.
Yes, it's generally, small children get this more often than not. I know my own child had it when she was about, a year old. And it can be very serious. But that is, we're seeing more adults, which is, of course, challenging when someone presents to the hospital. Is it COVID? Is it flu? Is it RSV? Or is it a lot of
Contagious?
a lot of those things?
Contagious. Okay, thank you.
And then we also have, just to update you, the good news is, as far as polio, we have had 2 weeks of negative wastewater tests for so far, which is very good. There have been 5 in-person school audits, which have been completed with the State Department of Health. And what they're doing in those audits is making sure that the children who are present in school are adequately immunized or have a medical exemption.
How did they pick the 5 schools?
Each year, every school is required, every school that has what's called a BEDS code is required to submit to the State Department of Education an immunization survey. So the state and the health department can see those surveys. So schools that had historically low immunization rates were looked at for in-school audits. Sometimes if a person comes to Orange County or to New York from another location, their immunizations are not entered into the state immunization system, which is called NICES. So, but they might have an immunization card, or they might have some other information that the nurse collects. So it might be in the child's school record, but not in NICES. So that's where we selected those schools.
Thanks.
And lastly, as far as infectious diseases, we are monitoring travelers from Uganda for Ebola. We've had 2 travelers so far. One was lost to follow-up. The state is aware. We believe they've left New York. And the other is what they call low risk, which is not requiring any type of isolation from the state department, or from the state or the local health department.
Okay.
Okay. The Department of Health has hired Steve Valdez as the new fiscal deputy. And as far as patient services, yesterday we had our quarterly internal quality assurance committee, and the professional advisory committee meetings took place, and all was well with the record reviews and with the physicians.
Person and Dr. Pointer is settling in
Yes,
nicely over there.
yes.
Okay, good. And just let her know that, if she needs anything,
I will.
and herself, that we're here. Do what we have to do.
Thank you.
With that, with any questions, I'll thank you both for being here. Wish you a happy holidays. Just legislative.
Happy holidays.
Oh,
Happy holidays.
Happy holidays.
Happy holidays and I'll make it.
okay. Very good. All right, thank you, ladies.
Thank you.
With that, it looks like the desk is clear, and I'll take a motion to adjourn.
So moved.
Or to account. All right, thank you, everybody.